The progress made in the global fight against AIDS is in grave danger. The world had set an ambitious but achievable goal to end the epidemic by 2030. Decades of coordinated efforts had drastically reduced both HIV infections and AIDS-related deaths, proving that through investment, scientific advancement, and global solidarity, it was possible to control one of the deadliest pandemics in human history. However, this progress now stands on the brink of collapse. The recent decision by the United States to withdraw from international AIDS relief programs has created a financial vacuum that, if left unaddressed, will have catastrophic consequences. Without immediate intervention, the world could see the resurgence of an epidemic that had been on the path to eradication, with millions of new infections, preventable deaths, and unimaginable suffering. The numbers paint a grim picture. The U.S. has been the largest contributor to global HIV/AIDS efforts, providing billions of dollars annually through programs such as PEPFAR and the Global Fund. This funding has supported life-saving treatment for roughly 20 million people, half of all individuals living with HIV worldwide. With the withdrawal of U.S. support, clinics are closing, medical staff are being laid off, and treatment programs are being halted. Already, more than 20,000 people have lost access to their medication, and this number will rise exponentially in the coming months. Without consistent treatment, many of these individuals will not only suffer from severe health deterioration, but will also face increased risks of developing drug-resistant HIV strains, making future treatment efforts even more challenging. This is not just a crisis for the most affected regions. The resurgence of HIV/AIDS will not remain confined to any one country or continent. It is a global threat that requires a global response. The medical community is unanimous in its stance. HIV treatment not only saves lives, but also prevents further infections. When people receive proper antiretroviral therapy, the virus becomes undetectable and untransmittable, meaning that each person successfully treated represents one less potential chain of transmission. Halting these programs, therefore, does not only condemn those currently living with HIV, it allows the virus to spread unchecked, reversing years of progress and bringing humanity back to the darkest days of the epidemic. The potential scale of this crisis is staggering. If the funding shortfall is not addressed, UNAIDS estimates that by 2029, the world will face an additional 9 million new HIV infections, 6 million AIDS-related deaths, and over 3 million new orphans. Vulnerable populations, including young women in sub-Saharan Africa, men who have sex with men, transgender individuals, sex workers, intravenous drug users, and migrants from high-prevalence countries, will bear the brunt of this catastrophe. Many of these groups already face systemic barriers to health care, and without funding, their access to HIV testing, prevention, and treatment will dwindle further. The solution is clear, but requires immediate action. The financial gap left by the U.S. withdrawal must be urgently filled by other nations, particularly those with strong economies and the ability to take leadership roles. Germany and Austria, along with other European countries, must step forward, not just with emergency funding, but with a long-term commitment to sustaining and expanding global HIV/AIDS programs. Without intervention, the world will face a humanitarian disaster of massive proportions, one that could have been entirely preventable. This is not just about money. It is about moral responsibility. AIDS remains one of the most devastating infectious diseases in modern history, and its resurgence would be a profound failure of global leadership. In an era where medical advancements have given us the power to end the epidemic, allowing millions to die due to a lack of political will would be an unforgivable betrayal. The upcoming Global Fund replenishment round presents a critical moment. With an estimated need of $18 billion, an amount that will only increase if PEPFAR is permanently dismantled, countries must step up with significant contributions. Germany alone should allocate 1.8 billion euros, not only to fill the gap, but to send a strong signal to other nations that the fight against AIDS is far from over. Time is running out. Without a rapid and coordinated response, the hard-won victories of the past decades will be erased, and the world will find itself confronting an AIDS epidemic that is more devastating than ever. The cost of inaction is measured in human lives, and history will not be kind to those who stood by and let millions perish. The choice is stark: step up and prevent a global health catastrophe, or do nothing and watch as an avoidable tragedy unfolds.